Private medical insurance doesn't cover things like pre-existing medical conditions. Please see my video on underwriting for a full explanation of this. Other things that aren't covered: treatment that isn't recommended by your GP or consultant. Perhaps you could see my video on how to claim, please. Emergency treatment would be covered, but private hospitals do not usually have intensive care units or casualty departments, and therefore in these cases emergency treatment is usually covered by the NHS. It is then possible to transfer into a private ward within the NHS or to a private hospital using a private ambulance. Chronic conditions are not usually covered. It is important to know that a chronic condition is not necessarily a life-threatening one. You could have chronic eczema, for example. Chronic merely means incurable. However, there is one chronic condition that most insurers will cover in full, and that is cancer. Any other chronic condition would normally be covered only through the diagnostic stages, and then afterwards only if there is an acute episode going forward. Of course, if this chronic condition was a pre-existing condition when you took out the policy, it would never be covered at all, and that includes cancer. Normal maternity is not an illness, and therefore it is not covered. Health screening is normally not covered through some policies, although some policies have an element of this within them. Cosmetic surgery is not covered unless it is needed as a result of an accident or post-restorative surgery. Fertility treatment is not covered, as is corrective eye surgery, and some insurers won't cover self-inflicted injuries or those which are a result from dangerous sports or pastimes, and sometimes as a professional sportsperson. If you'd like to speak to us about your requirements or have any other questions, please do call us on 01798 300 800.